I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. I am so glad you're with us. If you're just joining us, welcome. If you stayed with us, thank you. I'm glad you stayed with us. I always love the fact that you guys are spending a little time with me. And hopefully every show you walk away with information and say, that makes sense. And that's the biggest compliment I get. I always laugh. I said, I want a woman to whisper those three little special words in my ear. That makes sense. Because everything we talk about in healthcare makes sense. We give you the options of how to treat things without drugs and surgery. And again, if you need drugs and surgery, absolutely use them. But in most cases, if you do what we say, you're not going to need a whole lot of drugs and surgery. If you need them, take them. But I want to reduce or eliminate the need for drugs and surgery in your life. May not be able to do it. But if I can reduce it, if nothing else, you'll save a ton of money. Probably live a lot longer, feel better. And so there's no downside to getting healthy. That's the cool part about this. There's really no downside to getting well and staying well. You'll save money, you'll live longer, you feel better, your love life improves, you sleep better. Again, I can go on and on of all the benefits. So what we're talking about today are some of the hot topics we've had over the past 12 months and kind of give you a recap of each one of the topics. If you have questions, you can go to our website, drjoe.com, and you can send us a question. There's a little pop-up that says, hi, would you like to chat? Many times someone's live. It's either me or Garrett or Joe or Sierra, and we'll get right back to you immediately. If not, we will get back to you because some people say, hello, anybody there? Oh, great, nobody's there. That's what they'll type in. It's like, well, we can't monitor the website 24 hours a day because I guess we could, but I got to sleep at some point. So we will get back to you as soon as we possibly can, I promise you. So, all right, so we talked a little bit about, high blood pressure, diabetes, heart disease. We have the answer. Okay, the answer is really simple. Go to a plant-based diet. With heart disease, the studies have been clear as day that show that a plant-based diet can reduce or eliminate most heart disease patients' issues. So why wouldn't you do it? Well, I don't want to give up my cheese. I don't want to give up my booze. I don't want to give up my meatballs. Okay, it's your choice what you decide to do, of course. But why wouldn't you do it? I have patients that are just miserable on oxygen. And they say, well, doc, I'm not going to change my diet. Okay, it's your choice. But I can't imagine if I was on oxygen, I wouldn't be doing everything I possibly can to get well. I'm not asking you to run a marathon. I'm not asking you to paint my house. I'm not asking you to change my flat tire. I'm asking you to just change what you eat. And you have to eat anyway. Why not eat good food? That's the cool part. There's so much good food out there. And if you don't know what to eat, on our website, drjoe.com, we have a show, actually a lecture I did called So What Can I Eat? Just type in So What Can I Eat? It'll pop up in the search bar and you can listen to it. The first book I ever wrote was really a great guide on what to eat called Eating Right for the Health of It. And first part of the book tells you how to change your diet. Second half is recipes, over 200 recipes. And everything is in there that you can possibly imagine. Breakfast, lunches, dinner, snacks, salad dressing, soups. I got desserts in there. I got appetizers in there. So there's no reason why if you shouldn't change your diet because now you have the tools to do it. So here's my challenge. Make every recipe in the book. And if you don't feel better, I lied to you. And you wasted whatever it is, $16 for the book. But if I'm right, which of course I am, you'll say, oh my gosh, Dr. Joe, thank you. You saved my life. And that's the reason I get excited every day when patients say thank you. And the only issues we ever have with patients is when they don't follow our advice. I know I had a case the other day. He was in a car accident. And I always say, if you're in a car accident, come see us immediately. And he came in for 3 visits over 3 months. That's not nearly enough. And the insurance company offered him $1,000 to settle, and he took it. Now, this guy could barely walk. He couldn't even get on our table. We had to help him to get on our tables. He settled the case. It's done. He compromised his health for, pittance. It sounds like what Judas did. A couple of pieces of silver. And I thought, what are you, crazy? Oh, doc, I could use that money. But you can't walk. Drives me nuts. So the only time we ever have patients, and it's extremely rare, is when patients don't follow our advice. That's really one of the few times we ever have issues with patients. So if you want to become a patient, we'd love to have you as a patient because we want to do the nervous system, the digestive system, and your diet. Those are the 3 things you need to get well. And, we talk about heart disease, number 1 killer. So if we had a pill that said, okay, if you take this, the success rate is going to be astronomical when it comes to reducing pick disease, diabetes, heart disease, cancer, whatever it is. Would you buy that pill? Absolutely. What would you pay for it? Anything. Doesn't matter what I charge you would buy it from me. And yet, people don't do something simple that's free by simply changing their diet, making sure the nervous system's working properly, making sure the digestive system is working properly. I would say if you go to a plant-based diet, you can add about 11 quality years to your life. If you just give up dairy, 8 quality years. And yet people won't do it. But if I had a pill to sell them, they would take it. So anyway, that leads me into my next topic that we've covered a lot, obesity. How many people are overweight? Raise your hands. 65% of you should have raised your hands. And as you get older, if you're older, you know it's really hard to lose weight because your metabolism changes. It's called aging. It's okay. So you and I have to be even more strict about it. You know, Garrett and I joke about this a lot. You know, he's much younger than me, and he says, I'm waiting for the day when I just can't get away with eating whatever I want. And it's going to happen. It has to happen. It's part of nature. I mean, it's going to happen. And so when it's happening to you and you're having a hard time losing weight, that's when you really want to say, okay, I got to crack down. I got to listen to what Dr. Joe says. And you can live this lifestyle, folks. It is not hard. It's extremely inexpensive. You feel great. Your kitchen is so much cleaner. You're not frying meats and other foods that'll stink up your kitchen. I can't imagine why people wouldn't do this. It just blows my mind. Now, I remember bad foods taste good. I was normal once. And I remember those things. But we were talking the other day about drinking, and somebody brought one of my doctors in a bottle of, I don't know, some type of whiskey or something like that. And I remember the last time I had a drink, I was 29 years old. And I was on vacation, and they sent a bottle of champagne to my room, and I had one glass of champagne. And I felt awful. And I thought, I'm on vacation, and I just ruined a half a day of my vacation recuperating from drinking a small little flute of champagne. And I said, it's not worth it to me. And that was my decision, not worth it to me. So if heart disease and diabetes and cancer and obesity and high blood pressure and osteoarthritis, if these are worth it to you, then continue absolutely with your lifestyle. But if it's not worth it, if you're sick and tired of suffering, make a move. Do something. Do anything. If nothing else, start taking super greens and essential source, step 1. Then add the vitamin D to keep your immune system strong. Then you start listening to Dr. Joe's shows, and I want to re-brainwash your brain, or unwash your brain, I don't know what the right word is, about every commercial you see and how you need to eat more of these chips and how you need to maybe take this medication. Sometimes you do, but many times we don't. So with obesity, it's linked to 20 chronic diseases, including heart disease, stroke, diabetes, cancer, high blood pressure, osteoarthritis. 45% of Americans between 40 and 59 are obese. I've seen those statistics as high as 65%. So it's not hard, it's easy, and here's my secret. Everyone wants to know, Dr. Joe, give it to me quick. What do I have to do? I don't want to do any work. What's the one little magic pill, one little tidbit, one pearl of knowledge you can give me to lose weight? Here it is. Get the bad food out of the house. If it's in the house, you're going to eat it. How often? 100% of the time. I was given a bag of these chips that were made with beans. And they were lower in carbs and higher in fiber, and they were really good. And it was a small bag. And you know what I did? I ate the whole bag. Because they were good. Why? Because they were in the house. If they weren't in the house, I wouldn't have eaten it. So, of course, I eat a really good diet anyway, so I eat a lot of fruits and vegetables and a high-fiber diet, so it didn't have a huge impact on my life. But I knew that if it's in the house, I'm going to eat it. So you have to get the bad food out of the house. Not tomorrow, not once you eat up what's in the freezer, not after the pantry's cleaned out, not after the big sale that happened at the grocery store and you bought all the junk food on sale because it was half price because it was after the holidays. No. Get it out of the house now. I actually have a stream in my backyard, and I've already thrown food into the stream because I know if it's in a stream, I can't eat it. It's just that simple. So that's how I'm like you. My brain works like you. I eat sugars, I eat bad foods, and it stimulates the nucleus accumbens, which releases dopamine, and I get high from it. So you've got to get the bad foods out of the house. And you have to start when? Now. Don't wait till next week, after the party, after the birthday, after the celebration, after the holiday. No, now. Because every time you add more junk to the body, you're affecting the brain. We do a 21-day cleanse at our office, and it kind of resets the brain. And that's something I really recommend for people. If you just can't do it on your own, let's jumpstart the brain on a 21-day cleanse. So we have that. It's on the website, drjoe.com. Other topics we talked a lot about in the past several months. Osteoarthritis. Osteoarthritis is a mechanical issue. What that means is bones are out of place rubbing up against each other. And as the bones rub up against each other, the body produces a specific white blood cell. And that type of white blood cell goes in and attacks the inflammation. So it helps bring down the swelling. That's great. But it also eats away at the joint. And those white blood cells are not site-specific. What that means is they don't go to just one place. They go all over the body. And so they're attacking all the joints. And the joints, like big joints, like your hip, let's say, really aren't going to be that affected by these little white blood cells. Now, over time, they will be. But the weakest, most movable joints in your body are really going to show the impact. Where are the weakest, most movable joints in your body? Your fingers. So people come in and I'll say something about arthritis. I say, oh, Dr. Joe, look at my fingers. I got arthritis in my fingers. Chances are that's not a primary site. It's a secondary site. So you have an injury somewhere else in your body. Maybe it's a whiplash from a car accident. If your car's damaged, folks, you get a whiplash. Everyone does. So even if you don't get treated for it, I promise you it's going to become a problem later on in life. It has to. So the fingers are swollen because the white blood cells are attacking those joints. So it's not the primary site. I mean, if you jam your finger playing volleyball or something, yeah, that could be a primary site. But what I do with patients like that, I say, let's do an evaluation of your body. And inevitably, 100% of the time, I find a central arthritic area. Maybe it's the neck, maybe it's the knee, maybe it's the foot. We have to address the cause, the primary site, and the secondary sites. And then we get you on an anti-inflammatory diet because osteoarthritis is, like I said, mechanical. Now, there is a chemical component. The mechanical causes the body to react and cause inflammation. But there's always an initiating factor of mechanical. And that's where chiropractic care comes in. Chiropractors are very, very good at putting bones back in place. So it's a neck bone, a foot bone, a hand bone, a skull bone. My staff are all trained to actually adjust the skull. A knee issue. How many of you hurt your knees? How many twisted your ankles? All these issues can have long-term effects if you don't put the bones back in place. So my staff is trained to adjust from head to toe, all 206 bones in the body. So with osteoarthritis, we always got to get to the cause of the problem, not just treat the symptoms. Because again, if a bone is out of place and you don't put it back in place, it's going to wear out. How often? 100% of the time. So osteoarthritis is a real easy one. Find out where it's coming from, put it back in place, and then get on an anti-inflammatory diet. Osteoporosis. This is different than osteoarthritis. Osteoporosis is when the bones lose their structure. They get thinner. And you're more susceptible to fracture when you have osteoporosis because the bones are thinner. It affects about 54 million Americans, usually over 50. A couple of things that can help. Diet. Now, here's the thing. What's the first supplement you think of with osteoporosis? Calcium, right? Got to take calcium, build up those bones, got to take my calcium. Here's the problem. If you take calcium and you don't have enough vitamin D helps you absorb the calcium. Vitamin K2 tells the calcium where to go once it's absorbed. So calcium needs vitamin D needs vitamin K2. Now, we produce vitamin K2 in our bodies. However, in my vitamin D3, I also add vitamin K2 because it helps the D3 work more effectively. So I take Dr. Joe's vitamin D3 every day. I take 5 drops, which is 5,000 international units. I suggest you do too. Now, it's a good idea to get your blood tested to make sure you have enough vitamin D. I like my patients between 60 and 80 nanograms per milliliter. If you're below that, I don't consider that optimal. Now, the standard optimal is about 30 nanograms per milliliter. That's the standard. I don't think it's high enough. I think that's enough maybe to keep you alive, but not to thrive. And so I want to make sure you're getting those vitamin D levels up there. And it's so easy. It's so inexpensive. I always say it's the cheapest insurance policy you'll ever buy. Especially cold and flu season, COVID season, you'd want to be taking those vitamin D supplements every single day. 5 drops, I squirt it into my Super Greens and Essential Source. So I got a little jar. I take a scoop of Super Greens, scoop of Essential Source, some coconut milk or almond milk, shake it up. You can put it in your mouth if you want to. It has no flavor. And I'll just squirt it in there. It's part of my daily routine. My morning, I'm boiling water for my ginger tea, and I take the Super Greens, Essential Source, and vitamin D, chug it right down. Great way to start the day. You feel good. It's refreshing. And it gives you a ton of energy as well. And again, it may not give you energy the first day. It may take a few days to get that in there. So it's not like you can take Super Greens and Essential Source and so I didn't see anything happen. It's happening. It just takes time for the body to respond. So don't lose faith. Give it a few days. Give it a few weeks. You're going to see some good results there. So osteoporosis many times is avoidable. It's usually due to a high acid diet. If you're eating a lot of alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, what are they called? Say it with me. The 7 deadly sins. 7 deadly sins of nutrition: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. If you're eating the 7 deadly sins, you're eating a high acid diet. When you put acid in your body, the body has to neutralize that acid. The body uses calcium as its primary neutralizing agent. So the body is giving up calcium from the bones to neutralize the acids. So if you go to an alkaline diet, fruits, vegetables, nuts, and seeds, now you're able to absorb that calcium, put it into the bones where it belongs, and then you're in good shape. It's very, very rare I've ever seen, I can't think of anyone I've ever met who eats a plant-based diet who has osteoporosis or heart disease or diabetes. Extremely rare for that to happen. Can it happen? I guess it could. But, if you're playing the odds, plant-based diet is the way to go. And again, if you don't know what to eat, go to our website, drjoe.com. Listen to the show we did. First, listen to the 7 deadly sins of nutrition. That show, and we talk about alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. It's a lecture I did in California a couple of years ago. It was a lot of fun. We had a great audience, and we had a guest panel. There's a lot of famous people there. It was kind of cool to meet a lot of famous folks, and I was the guest speaker. And then you want to listen to So What Can I Eat? And So What Can I Eat tells you what to eat. My book, Eating Right for the Health of It, is a great guide. If you're looking to really jumpstart everything, the 21-day cleanse or 21-day detox, 21-day weight loss program, it's all the same thing. It's on the website, drjoe.com. Look under services. Services, weight loss, there it is. And we can get you on that too. A lot of people do that beginning of the year. They kick off their new year with the 21-day protocol, and it's really successful because you're in that mode. You're excited. It's a new year. It's a new me. And once you get it rolling, many times that's the impetus that you need to get the body functioning where it should be. So that's all on the website, drjoe.com. And again, all the shows we've talked about here, we've done shows on up to this point. Now, I want to talk about hearing loss real quick. My father was deaf. My father fell off a ladder a few months before I was born, broke his back, fractured his skull, went deaf immediately. My father never heard my voice. And what a guy, because he would come to my plays. I was an actor, surprise, surprise. High school, college, I did a lot of acting. And my father would come to the plays. He'd come to my football games. He'd come to my swim meets. He'd come to my hockey games. And he sat in the audience. And after every play, oh, Joey, that was good. That was like Broadway quality. That was great. And I'm thinking, I used to joke with him, how do you know you couldn't hear anything? He goes, I know. Wow, you're good. But my father was deaf. So I was hoping, the reason I became a chiropractor actually is I planned on being a neurosurgeon. And I spoke to different neurosurgeons. I was 15, 16, I guess. So my thought was my father fell, broke his head, broke his skull, and went deaf. Maybe it's a nerve issue. I can go in there and do surgery and bring my father's hearing back. Kind of a grand goal for a teenage boy. But I started talking to different doctors. And every one of them said the same thing. Don't do it. It's a lot of work. It's late hours. It's blood. And this is back when insurance companies actually paid doctors and people got dressed up to go to the doctors. And then I remember walking into a chiropractor's office because my grandmother said, why don't you go talk to my chiropractor? They do something with nerves. And I said, oh, okay. And I remember I had hair down to my shoulders, 210 pounds, T-shirt with a flannel shirt open, Wrangler blue jeans, and work boots and a beard. And I walked into this chiropractor's office on Patterson Ave in East Rutherford, New Jersey, and he couldn't have been nicer. Didn't know who he was. Just walked in, chiropractor, I don't know what that is. Ho-dee-do. And I walk in, and he explained chiropractic and the nervous system and getting to the cause of the problem. He had charts and diagrams and arrows. And he said, if you need ideas to go to school, go to Life University in Marietta, Georgia. It's the best one in the world. And I'll write you a recommendation letter. And I was like, this guy's really nice. So I went to go talk to another chiropractor. He loved his job. So I thought, this is really cool. I like these guys. So it wasn't really about philosophy at that time. It was about, I like these guys, and it was kind of fitting into my mode. I liked the idea of getting to the cause of problems. So I said to my mother, Mom, I want to become a chiropractor. And she said, I don't care if you become a garbage man. Just be the best garbage man you could possibly be. So I was told by my mother that I had to become the best I could be. And the last time I saw my grandfather, he was visiting relatives in Alabama. I went out to Alabama. I was in school at the time. And as I left, he said, you become the best doctor you can be. And I said, okay, Upa, German, Upa. The next day he passed away. He passed away that night, actually. So it was the last words he ever said to me. So I have a drive to be the best I can possibly be. And then I heard about the first chiropractic adjustment ever, September 18th, 1895, Davenport, Iowa. Dr. D.D. Palmer, his janitor, felt his neck pop years ago and he went deaf. So Dr. Palmer thought, well, if I unpop his neck, maybe he'll bring his hearing back. And he did. He adjusted, the first adjustment ever, on a wash bench, according to the story. And Dee Dee and Harvey Lillard was the janitor. Harvey Lillard heard the horse carriages in the street, as the story goes. So September 18th, 1895 changed my life because I said, oh my gosh, he adjusted somebody who was deaf, brought his hearing back. And so that's it. Obviously, I'm meant to be a chiropractor. In my career, I've had three patients, I think, get their hearing back through chiropractic care. My father never got his hearing back. His entire life, he was deaf. But what that says is that the nervous system controls everything. So when people ask me questions, do you think chiropractic care and nutrition and digestion would help my blank? The answer up to this point has always been yes, because I've never known it not to help somebody. Now, it may not cure everything. I'm not saying I have a cure-all. But what I am saying, if you have the nervous system working and the digestive system working and a good diet, good supplementation falls under good diet, it's pretty amazing what happens. And I've seen it happen thousands and thousands and thousands of times in my 38 years now in practice. So if you really want to get well, if you're serious about wanting to get well, I can go through other things. I had a list. I want to talk about cancer and bladder problems and dementia and back pain and depression. All that's on the website, drjoe.com. Just type in what you're looking for. We've covered a show. But I wanted to tell you that no matter how long I've been in practice, every year the same issues keep coming up. And the same treatment keeps coming up. Now, again, we have medical. We have a doctor who can do pain injections into the spine, into the foot, into the knee, into the wrist. So we can do injections if we need to. We can do medication if we need to. We can do PRP. PRP is platelet-rich plasma that stimulates the healing process in your own body. It's your own blood cells. We take your blood cells out of your body, spin them down, inject them back into the body, and it stimulates a healing cascade, we call it. So we use your own body, not stem cells from some baby somewhere or some injections or drugs. So we can do PRP, and it's great for hair restoration. It's great for wrinkles. It's great for erectile dysfunction. For women that have leaky bladder or weakened vagina areas, we can do this right into the area. We can do it in arthritis, knee arthritis. Folks, if you have knee or shoulder or foot arthritis, please consider chiropractic and PRP first. If it doesn't work, you can always have surgery. But I want you to do it right the first time. Less expensive and many times more effective than other treatments. And again, it may not be best for you, but we can make that decision when you come in. So I would love the opportunity for you to say, Dr. Joe, new year, new me, I'm ready to get well and stay well. So if you have health issues, neck pain, back pain, headaches, numbness, tingling, sciatica, peripheral neuropathy, come see us. Stop suffering needlessly. And again, I can't promise anything, but you can make an appointment right online, right on the website. It's a picture of me, and right next to it says appointments. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. The initial visit used to be $375. We've reduced it to $199. Exam, x-rays, consultation, first adjustment, then going over your x-rays on the next visit, and a nutrition evaluation. And then if we do need more treatment after that, my staff will come in and talk to you about a treatment plan. We accept most insurances. Again, if you've ever been in a car accident, if the car was damaged, you were damaged. Come see us and stop suffering. Bring your kids. Kids have spines too. I've adjusted a baby as young as probably about 8 minutes old. Out of the womb, wiped off, and I adjusted her. So there's no reason why you should be suffering in the upcoming year. And that goes for your family as well. Now, can we promise everything? No, we can't, but the results we usually get are just spectacular. If you're a military person, if the VA doctor refers you to us, from what I understand, the VA will then cover your treatment. So if you're in the VA, a lot of people say, I have issues from military service, and thank you for your service. It's pretty amazing that now the VA is saying, you know what, chiropractic is amazing. The VA even covers PRP, from what I understand, for some doctors. I'm not sure if it covers all of it. But the VA is becoming so progressive and saying, you know what, maybe we should be considering these, I hate to say alternative, options for our people because they work. If they didn't work, they wouldn't be around since 1895. So if you're ready to get well, if you want to lose weight, if you have digestive issues, if you have health issues, come see us and let's see if we can help you. I would love the opportunity to work with you. Again, the website, drjoe.com. All the supplements we talked about are available on the website, Super Green Essential Source, vitamin D, nitric oxide, all on the website. Or come see us and pick it up and it'll save you some shipping. So again, go to the website, drjoe.com. If you have any questions, let us know. Thanks for listening. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.